Why use a neonatal peripherally inserted central venous catheter, PICC? In order to provide reliable, medium to long-term access for the intravenous administration of all types of medication and drugs. Which flushing technique do you recommend? We recommend the push-pulse technique. This creates turbulence which cleans the inside of the catheter and helps prevent fibrin formation at the catheter tip, thereby reducing the risk of occlusion. How do you measure the catheter length required? We use the 3-step measurement technique for newborn and premature infants. Start at the insertion site, measure up to the mid-clavicular area and finish alongside the right nipple line. It is mandatory to take an X-ray to confirm catheter tip position before using the PICC catheter. Is it possible to administer or sample blood and blood products using a 1 French and 2 French PICC catheter? No, this is not recommended. What are your recommendations for flow rate if the catheter is not being used for drug infusions? We recommend a minimum flow rate of between 0.5 and 1 ml per hour. What is the ideal tip position for a PICC catheter? Introduced peripherally, the distal tip must be located at the junction between the superior vena cava and the right atrium, which allows the catheter to be used for all types of drug therapy. This means pH osmolarity. Warning: never place the distal tip of the catheter in the right atrium. What size syringe should be used to flush the 1 French and 2 French PICC catheters? Use 10 ml syringes to flush. Warning: never use 1 ml syringes. How can infections be limited? Always work aseptically and follow local protocols. Correct hand washing technique. Wear 2 pairs of sterile gloves for catheter placement. Use chlorhexidine to disinfect the skin. Prepare the area thoroughly. Maximum barrier precautions. Fix the catheter correctly and follow dressing change protocols. Always use an occlusive dressing. Maintain a closed IV system using needleless access devices. Conduct regular trainings and practical workshops. What are the benefits of using a double or triple lumen octopus extension with needleless access system? It is a closed system. You can access the catheter for infusions or direct bolus injection without opening the line. Reduced risk of occlusion that can be caused by repeated clamping. Low priming volume. When disconnecting the needless access system, it displaces a volume of 0.03 mils from the catheter towards the patient. This prevents blood returning to the catheter and prevents catheter occlusion. What is the disinfection procedure for the needless access system? Clean the surface of the needless access system for 30 seconds before and after use and allow to dry.